The name Ebola still strikes fear in Central Africa, where it has haunted communities for decades. The virus has left a trail of devastation affecting countless lives and livelihoods. On September 4th, 2025, the Democratic Republic of the Congo announced its 16th outbreak, this time in the remote Bulape health zone of Kasai province. For families here, Ebola is a personal threat, one that can devastate entire communities in days. The fear is palpable and the stakes are incredibly high. As of mid-September, there are 81 suspected and confirmed cases, with 28 lives lost. The numbers are rising and the situation is becoming more dire. Each number is a family shattered, a community on edge. The emotional toll is immense and the grief is overwhelming. The case fatality rate is 35%, a stark reminder of Ebola's lethality. This statistic underscores the urgent need for effective intervention. Over 700 people are being monitored daily, each a potential link in a chain that must be broken. The efforts to contain the virus are relentless. The virus spreads through direct contact, making close-knit communities especially vulnerable. The social fabric of these communities is at risk. But this time, the DRC has a powerful tool, a highly effective vaccine, deployed immediately after the outbreak was declared. This could be a game changer. The race is on to get vaccines to the front lines and stop Ebola in its tracks. The hope is that this swift action will prevent further tragedy. Just 10 days after the first case, hope arrived in Bulape, not with fanfare, but with the hum of a cold storage container carrying 400 doses of the Ebola vaccine. In a region where medical resources are scarce and distances vast, the arrival of these precious vials marked a turning point. The community watched anxiously as health workers carefully unloaded the shipment, knowing that these vaccines could mean the difference between life and death. Health authorities, led by the DRC Ministry of Health and WHO, moved fast, shipping vaccines directly to the epicenter. Their rapid response was crucial as every hour counted in the race to contain the outbreak. Teams coordinated across borders and agencies, working around the clock to ensure the vaccines reached those who needed them most. The strategy, ring vaccination, immunizing contacts of confirmed cases, their contacts and frontline health workers. This method, proven effective in past outbreaks, creates a protective barrier around each case, stopping the virus from spreading further. This targeted approach builds a wall of immunity, cutting off the virus's pathways. By focusing on those most at risk, health teams maximize the impact of every single dose, protecting both individuals and the wider community. Delivering vaccines to remote villages is a logistical challenge. Health workers travel for hours, sometimes on foot, to reach those at risk. They cross rivers, trek through dense forests, and brave difficult terrain, all to ensure that no one is left behind. They carry not just vaccines, but the responsibility of building trust, explaining the science, and overcoming fear. Conversations with families are as important as the injections themselves, as understanding and acceptance are key to success. This is a global effort at a local level, with WHO, UNICEF and international partners ensuring a steady vaccine supply. Their collaboration brings expertise, resources and hope to communities facing the threat of Ebola. The International Coordinating Group has approved 45,000 more doses for the DRC. This massive shipment will help sustain the vaccination drive and protect even more lives as the response continues. Collaboration is essential. No nation can fight Ebola alone. Partnerships between countries, organizations and local communities are the backbone of this response, uniting expertise and resources from around the world. Every dose delivered is a step closer to containing the outbreak. Each vaccination is a moment of hope, a promise that the tide can be turned with determination and unity. The world is watching and supporting this fight. In every corner of the globe, people are standing in solidarity with those on the front line, determined to see an end to Ebola. The Ebola vaccine is a triumph of science, representing years of dedication and innovation, offering hope to communities long haunted by Ebola and its devastating impact. It works by showing your immune system a harmless version of the Ebola virus's surface protein, like a wanted poster for your body's defenses, alerting it to danger. Scientists engineered a harmless virus to carry this protein, training your immune system to recognize and attack Ebola if it ever appears in your body. The result, a rapid, powerful immune response that can protect within just 10 days of vaccination. This breakthrough is the product of decades of research, accelerated by past outbreaks and global collaboration. The vaccine has transformed Ebola response from desperate containment to proactive prevention, saving countless lives. For health workers, it's a shield. For communities, a beacon of hope and resilience. Every shot is a chance to break the cycle of fear and loss and build a safer future. Science has given us a fighting chance against Ebola. Though the outbreak is centered in the remote Kasai region, its implications reach far beyond this small village, reminding us that in our interconnected world, health threats can quickly become global challenges. A threat anywhere is truly a threat everywhere, no matter how distant it may seem. The World Health Organization rates the risk of national spread as high, urging vigilance and preparedness. But thanks to swift, coordinated action, the global risk remains low. Frontline health workers, doctors, nurses, and dedicated volunteers are the true heroes of this fight, risking their own safety to protect others. They work long hours in tough, often dangerous conditions to vaccinate, provide care, and educate. By building trust and explaining safe practices, they help break the chain of transmission and protect entire communities. This outbreak is a powerful reminder. Global health security depends on investment, innovation, research, and international cooperation at every level. Strong health systems and rapid response teams save lives, not just in the DRC but everywhere. In Congo, science, courage, and community spirit are turning the tide. Every vaccine given, every patient who recovers is a victory for all of us. The world stands with the DRC, united in hope, resilience, and determination to overcome. Global health is a shared responsibility, and together with solidarity and action, we can defeat Ebola.